Good afternoon and welcome to this Journalism in the Time of COVID panel. I am Mia Malan. I'm the editor of the Bekisisa Center for Health Journalism in Johannesburg, and I'll be in conversation with some really great panelists, four of them this afternoon. The issue that we'll be looking at is what happens when a pandemic forces journalists to become health reporters overnight, and they expected to report on science and research results and health policies that they were previously unfamiliar with. Is it a good thing for health journalism, or does it lead to misinformation? And how have business and investigative and political journalists coped with this situation? On our panel, we have two prominent Africa journalists and editors. They are both non-health reporters, Ferial Haffiji from South Africa's Daily Maverick and Asha Miwulu from the media startup Debunk in Kenya. And we also have a health journalism trainer, Ida Jooste from the media development organization Internews. And lastly, we have an epidemiologist, Professor Taryn Young from Stellenbosch University's Center for Evidence-Based Healthcare, and I'll tell you a little bit more about them as they make their opening statements. But meanwhile, here's how the webinar is going to be structured. I am going to ask each panelist a question for which they have about 5 to 7 minutes to respond to. And then we're going to go straight to your questions and comments after that. If you have a question or a comment, please enter it into the Q&A box rather than raising your hand. And you don't have to wait until question time. You can enter it as the panelists make their presentations as it pops up into your head. So we're going to start off now with Ferial Haffiji for our first speaker. She's the engagement editor at the Daily Maverick in South Africa. And Ferial is a really influential South African journalist. And previously, she was also the editor of the City Press, the Sunday newspaper in South Africa, and the Mail and Guardian. And she's known for political and investigative and business journalism, not health reporting. But when COVID arrived, she started to extensively report on the pandemic. And I would like to ask Ferial, how did this work, Ferial? How did COVID change your job? What challenges did you experience and how did you get around them? Over to you, Ferial.
Good afternoon, Mia and colleagues. It's lovely to be with you this afternoon. And what an intriguing panel. It's really made me think quite a bit. So Mia, if I may, and I trust that I'm in a circle of trust, I'll tell you a couple of really awful moments that happened as I embarked on this beat, which was quite new for me. At some point in my reporting, I confused a physician and a surgeon. I got bacterial infections and viral infections wrong, and I needed to have extensive tutoring from a pulmonologist on how the lung worked. So this was just to give you an indication of how little I knew. And this was because I'd always been in the world of kind of more what's regarded as conventional investigations. When I was a very young reporter, I used to cover the Third Force and the hit squads in the late 80s and early 90s. And then post-democracy, I've really been quite close to the stories of state capture and corruption of our state infrastructure system. So that's been more Transnet, SAA, Eskom, the energy infrastructure, not really health infrastructure. I had done many political investigations. I had always railed against the view that health, welfare, and development were kind of soft beats. But now this year has really taught me why those stereotypical views of health as a soft beat has completely wrong. And COVID has taught me that. So what I've learned this year is that health reporting probably is the most vital of the beats. Because I've learned it's literally a matter of life and death. And it touches every single part of our reporting life, as we've seen this year. It's been about life versus livelihoods debate. Was a lockdown the right thing to do? With the lives we've saved, I don't think we've reached the end of this pandemic, but when we do a first count, yesterday was 200 days. Was that a worthwhile balance to make? I've learned that health reporting and investigative health reporting, it's more systemic driven and process driven rather than event driven, unlike conventional investigations. And what I realized very, very early on is that you actually can't apply the same mores or tactics or styles to it, because screaming headlines and breaking news don't really work. So, example, when I heard on a radio station that the Russia had come up with the first working vaccine, it wasn't really true at all, and it took great training. And this is where I want to speak quite a bit about the epidemiology course which you ran together with colleagues from Nigeria, Canada, etc., for 70 or so African journalists. For me, that really is the way to go, because it used every single technology. And then together with people like Dr. Taryn Young, it taught us how to ensure that we knew about vaccine trials, how to ensure that we understood the science. And that has been completely invaluable to me, is that you actually need to be inducted into this beat. Then, of course, it did become more conventionally investigative. And that's when we learned that all the billions of rands that were being invested into the response in South Africa, but I know it's also happened in the rest of Africa, was as usual being corrupted. And this is where you really saw the rubber hit the road, because it literally was life and death. It showed you that corruption can kill, and it can see us wasting very vital health resources. So for me, it has completely changed the rest of my reporting life. I'm going to stay with health. I want to stay quite close to the development of the National Health Initiative in South Africa. And of course, I have great concerns that system which is going to see the state procuring all goods and services could be subject to the same PPE corruption that we've seen. And I think it's given us an idea of how to report health corruption very differently. We have to get in at the top and watch how the money is planned and then how it's spent. And for me, that's where health reporting should go to in the next couple of years, to catch the corruption before it happens. Because what you see at the Zondo Commission, where I spend the other part of my reporting life, is it's pretty useless trying to get it once the money's all been frittered away and people are suffering, no stations, no trains, etc. It would be very good if we made this NHI work from the get-go. And for me, journalism should play a very big part in that. So just thank you for arranging that course. It really has been a life changer for me. Huh?
Thank you very much, Ferial, and thank you for being so honest and bold and concise about the lessons that you've learned. It's been really, really useful. We're now going to move on to Asha. So Asha Mawulu is from Kenya, and she is an investigative television journalist. Traditionally, she was the CNN African Journalist of the Year in 2016. And Asha, if I remember correctly, that you won the award for a story about security issues on the Kenyan-Somalian border, which is very far removed from health issues and health journalism. So you have been an investigative journalist, and you've also done stories around terrorism in Kenya. And just as COVID started, you moved from your job as a television editor and journalist and launched a media startup, Debunk, that does a lot of explanatory broadcast journalism on political and other issues in Africa. Now, how did COVID influence what Debunk does? Because the epidemic and the media startup almost started together. And have you had to adjust your activities and what you were going to report on for this media startup? Over to you, Asha.
Thank you, Mia. And it's great to be here with colleagues and friends. So my story with, coronavirus has changed my life. Like Ferial, I'm going to be very honest and hope that this is a circle of trust again. So coronavirus for me started with Friday the 13th, literally. Friday 13th, 2020 is when Kenya reported the first case. I remember sitting in the newsroom. I had only 10 days at Citizen TV, where I was working at the time as the investigative editor, special projects editor, and I had only 10 days to serve. That was my notice period remaining. And here is this big story that has just emerged that changes my entire life, changes my entire year, and all my plans that I had. So I was planning to found Debunk Media, a digital media outfit. And these plans were in motion since October of last year, and my seniors knew about it. So I was really ready to just leave. But when COVID happened, we had a sit down with my senior editors, the editorial directors, and they said, look, you're our most experienced reporter when it comes to specialized reporting. There's no way you can leave the newsroom now. So what did I do? I suspended my resignation, and I ended up staying in the newsroom for an extra 2 months. And this was just like an experience like no other. So I am used to reporting from the front lines. I have covered Al-Shabaab in Somalia. I have gone to the border of Kenya and Somalia, and that's the story that won me the CNN award. I've also, I've done a lot of work around police brutality. And when it's outside of security, it's usually like, people in power. So policy issues. I do cover corruption scandals and corruption scandals. So I'm not your typical health journalist. This was just completely out of my comfort zone. But I can say what COVID did for me in that moment is that it took me back to the basics. So here I was, I had to, put my editor's cap aside and say, I'm a field reporter. And I started going into the markets and, talking to people and seeing how coronavirus was affecting lives and livelihoods. And I just had to go back to the basics of, reporting. And then I had to relearn a lot of things. So just like Firial said, you have a lot of perception about health reporting. And I think it's a problem with how health reporting had been branded before COVID-19, that it's sort of the vegetables of news, the soft stories that features reporters would be assigned. But for me, it ended up being like one of the toughest stories I've covered. One, the empathy involved, the level of emotional intelligence that I needed as a journalist to navigate this ever-evolving story, and one that I did not even have resources for it. I had never covered a pandemic before. I didn't even know that you could have a pandemic to this, this extent. This was the first time that I was seeing this. So one of the first things that I did at Citizen was to bring in doctors who had gone to Ebola zones, Kenyan doctors, just to tell us how is it dealing with a health crisis of this magnitude. And that really, really helped. My investigative cap was also very helpful because I ended up being the first Kenyan journalist into the coronavirus wards, to try and find out how the wards look and what is this monster that we are dealing with. But after 2 months, I figured, you know what, I needed to still live and go on with my plans. So Debunk Media was waiting for me. My team that was supposed to launch this startup, the plans was to launch Debunk in April, but we had to put it on hold. First and foremost, the content that we had created could not resonate with the public, with the audience, because everyone was talking about coronavirus. People wanted to know where this story was going. And here we were, we had, created content around like legalization of marijuana and, feel good content around music, but using data to drive those stories. What coronavirus did for us is to really center us into what Debunk Media wanted to do, and is now doing, which is data reporting, putting data at the center of storytelling. And when we founded, when now Debunk launched finally on the 1st of July, we sat down with the team and said, you know what, even though it's been a couple of months of coronavirus coverage and there's a bit of COVID fatigue, we cannot not tell this story. So in our own way, we looked at what hasn't been told or what hasn't been reported on really well. And having a small team with a startup allowed us to get into what you can't do in a bigger newsroom, in the local newsrooms. And that meant we could scrap the data. I learned that you don't have to be working on a big story to actually go and scrape data and find data that will be very useful and make sense of it. And that's what we did with coronavirus. It also showed us the intersection of health to a lot of the other stories that I covered before, that I hadn't seen them, with a health angle. So climate change, for instance, even police brutality. And Mia, you remember just before I launched Debunk, I called you because Kenya, Nigeria, and South Africa was having a big problem with police brutality during the coronavirus pandemic. So coronavirus also showed us as Debunk the intersection of all these topics that sometimes we think are not very related, that it's not just a health story, right? It's, yeah, health is affected, but it is a story about policy, it's a story about corruption, it's a story about climate change. And I would say that, you know, it's been a real learning of my profession as a journalist and as an investigator, of what the audience needs and the stories that can be important to them.
Thank you very much, Asha. And thank you for also pointing out that an epidemic opens up all sorts of avenues for stories, not necessarily just science stories, that it really is almost like a mirror of society that tells you what society looks like, and almost like a magnifying glass. So we're going to move on to our next speaker, who is not a journalist. Professor Taryn Young is the director of the Center for Evidence-Based Healthcare at Stellenbosch University, and she also heads up the Division of Epidemiology and Biostatistics at the university. Now, Taryn is an epidemiologist, as you would imagine, and before COVID, none of us, or many of us, did not know what an epidemiologist was. Now we know that they're a little bit like disease detectives who identify the causes of diseases and people who are at risk. And Professor Young has published over 100 peer-reviewed research articles. And I'm mentioning this because during COVID, research is working very differently. We are seeing fast-track research that are being published as preprints, which means studies that have not been peer-reviewed. And that changes the situation, and the media has to figure that out and cope with it. So I would like to ask Taryn, you as an epidemiologist, have you come across confusing COVID media reports as a result of this situation of fast-track research and everyone having to report on COVID? Have you, for instance, seen study results being misreported or myths that are incorrect being reported and that it's resulted in misinformation? And if so, what do you think can be done to better equip journalists to do this? Taryn was also a co-instructor in the course that Bekisisa presented for in epidemiology for journalists across Africa. We were not the presenters, epidemiologists were, we just hosted it. But Taryn can also maybe share some lessons from that. Taryn, over to you.
Thanks, Mia, and thank you so much for the opportunity to be joining you and to give some input. Now, I think I just want to, I'm going to step back a little bit and just to remind that if one wants to have good and solid health information reach the public and you want it to be sound, you need a number of factors to be in place. You need good science, you need research to have been done well, you need that research and transparent scientists. Then that's where the journalist needs to be able to pick up the findings of that research and think and use it critically to then have some clear reporting by the journalists to the public. And as you say, with the pandemic, things have been moving so fast that with research rapidly increasing, there is research that's not even going through the peer-reviewed process, that's being published and put out in the public domain. So everything is being fast-tracked to get results out as fast as possible. And as a consequence, yes, I have seen misinformation and flawed research being put within the media. One example is linked to this big difference between association and causation. For instance, there has been reports linked to smoking, and if you smoke more, you are less likely to become infected with COVID-19. But those studies are being reported without critically looking at bias, which when we talk about bias, we talk about deviations from the truth, or without critically thinking about how big was the study. Was the study big enough to give us a robust answer, or could it have been due to chance? And looking at other things such as confounding or factors that causes a mixing of effects. So it's important to keep these things in mind when you're looking at research and considering how to use it. Another example that we've seen repeatedly in the media is around using hydroxychloroquine as treatment for COVID. Right in in the beginning of the pandemic, there was, one could see that there may be theoretical benefit in using this treatment. And then there were various types of studies that were done to look at it, from ecological studies to what's called observational studies, and ultimately experimental studies, both controlled and uncontrolled experimental studies. Now, if you want to decide on whether something works or not for treatment, there's what's called an evidence hierarchy, where right on top would be a synthesis of all studies that's been done in an experimental way with a control group to see whether this treatment works or not. And now, where we are today, there's been a number of these trials that's been completed, and that clearly shows that this treatment doesn't work. And yet we still see ecological studies or observational studies that's being reported in the media saying that this treatment works. So what can be done to enhance the capacity of journalists to be more critical? And I often think of it as getting in touch with your 5-year-old self, which didn't settle in terms of the questions that you ask about why and how. So it's about being critical in terms of research that's been used. And the epidemiology course that we offered collaboratively in July 2020 was fantastic. We had journalists from 18 different countries in Africa attending this course. And this course was first offered in India by Prof. Madhupai, and he was integrally involved in putting the various sessions. I thought it was fantastic. On a Monday and Thursday evening between 7 and 8:30, there were more than 60 people online, all joining in to learn more about epidemiology, to learn more about different types of research designs, different types of bias and confounding, and talking about error, and also covering tips in how to critically appraise medical research. And I think it's so important that we have more of that we have more courses to equip journalists to be able to be critical consumers of health research, to streamline and inform transparent reporting of health in the media, because journalists play such a critical role in information and evidence reaching the public on both prevention and treatment. Lastly, what I want to just highlight is that when we talk about evidence-informed decision-making, it is a collective effort with everybody playing a role in it. And linked to that, another strategy that one needs to think of and start to do more of is to get journalists and researchers to work together to enhance the reporting of research findings within the media. Thank you.
Thank you very much, Taryn. And thank you for pointing out that, sometimes we're confused in the media whether there's an association between two things or whether there's a causal factor. And when we asked for feedback from journalists, it was really interesting to see who attended this training course that Taryn presented. It was 3/4 non-health journalists, which was very exciting, political and business journalists. And one of the most valuable things to them and their feedback was that they learned the different types of research designs. When can you say something is caused by something, and when can you not say that? And that really helped them in reporting. So thank you for collaborating as an epidemiologist with journalists to teach us more. Our last speaker is going to be Ida Uester. And Ida works for an international media development organization, Internews Network, where she's the global health media advisor, and she designs and she implements health journalism trainings and programs. And Ida's also experienced health journalists. People from South Africa will remember her for her HIV reporting on the SABC during the late 90s and early 2000s. And Ida has often worked with bringing science and society together. So I would like to ask Ida, one of the difficulties with reporting on pandemics is to integrate the science with politics and vice versa. How do you think the news media has fared with this? And do you think COVID has opened up opportunities and an appetite for health journalism training that didn't exist prior to the epidemic?
Thanks a lot, Mia. This is an absolutely fascinating discussion. I think what Ferial and Asha and what Taryn have said, what everybody has said has been, is about how humbling it has been. I actually want to say COVID-19 has been humbling even for health journalists. So whereas, Ferial, you said virus, bacteria, most health journalists really know the difference between a virus and a bacterium already, but this is a brand new virus. Most health journalists have not reported on a pandemic, in other words, where there are global implications to decisions, to misinformation, etc. Some of the nuance of the new and very swift moving science is about, sorry, I actually didn't start on my first slide, I think, but that doesn't really matter. Health journalists have typically perhaps, have to deal with kind of very much more slow moving science. You mentioned the HIV epidemic, pandemic, Mia. COVID-19 is a little bit like 35 years of HIV into 8 months, 8 or 9 months. That applies to what Taryn has just said about peer-reviewed science, about understanding really the difference between kind of evaluating science and publications that have not yet been published and those that have been peer-reviewed. Even the phases of a clinical trial, it's incredibly complex. All of the fast-moving science around vaccines, it's humbling even for health journalists. Now, recently, because of President Trump, plasma and antibodies have been in the news, entirely new and experimental areas in science. So humbling all around. So this making meaning of swift moving science is tough even for health journalists. But they do have a certain advantage because of the areas that we've mentioned, which they have at least already explored. What does this advantage give them in terms of taking the story further? A little bit, but again, it's complex because the COVID-19 story, as others have said, bring into it so many other areas of life. I want to say it also brings into life and into our storytelling other areas, other isms, other ologies, other areas of study that are also extremely complex. For instance, now I can't advance my slide. No, I can. It's brought mathematics and statistics and dealing with numbers right into our faces every single day. Most people very many people who hadn't stared at mathematical models before, who didn't have an app. I mean, in South Africa and many other countries, there is an app. There's been a way to check the sort of the rise in cases. That has not been common practice before. What can health journalists and journalists who over time have become health journalists bring to our understanding by understanding mathematics and statistics better? Well, one thing is, we all know the flattening the curve graph. At the heart of that is something incredibly fundamental to understanding COVID-19 and a pandemic and understanding lockdowns. At the heart of that is something so fundamental that I sometimes feel ashamed that I'm not even always able to describe it really well myself. It's what exponential growth is. What is exponential growth? All of the epidemiological modeling, all of the lockdowns are based on the fact that this is a highly contagious virus and it can grow exponentially if not halted. So now the graph that we've been staring at, so one of the dangers again of sort of getting to grips with mathematics and statistics is that they seem like evidence. They seem verified and tangible and real. And also people get inured to numbers. How many times have we heard that now 210,000 people have died in the States? I think the number for South Africa is 18,000. It's lower in other parts of Africa. Something about numbers is also that after a while, they lose their meaning. So we need to find, even now, even months after lockdown, even if as countries are beginning to ease and have already, sort of some off quite far into the easing of their lockdown, we still need to be able to describe the spine and the heart of why lockdowns were introduced in the first place. So there's another way to describe exponential growth. It comes from quite an old French riddle about how lily pads, the leaves in a pond, how they grow exponentially. If you know Lake Victoria, you will know water hyacinth does this. On a certain day, in this lily pad, as the riddle goes, there was 1 leaf. And the next day there were 2 leaves. And the day after there were 4 leaves. And the day after there were 8 leaves. Until the lily pad or the lake was completely overrun by leaves because of the way that leaves grow. So in our lives before COVID-19, the type of growth that we've been accustomed to is the type of growth that you and I, our minds can comprehend it. It's perhaps, as a journalist, the idea that one can write 2 stories a day, maybe. Maybe if you work for radio, you're required to write 2 stories a day. What do you have after 7 days? You have 14 stories. Or if you have a 5-day work week, you have 10 stories. Our minds can comprehend that type of more linear growth. But exponential growth is that if today it means that we add a multiplier rather than an addition to this growth. So in this lily pad riddle, the riddle goes, it takes 30 days for the lake to fill. Where are we at day 29? And where are we at day 15? So I don't know if you want to type your responses in there, but it's an illustration of how exponential growth works, and it kind of helps us kind of deal with this really complex statistical issue. It's in university statistics. Exponential growth is one of the key complex areas of science that is being explained. And what it actually happens is, on what day is the pond half full, is the question. Is the pond half full on day 15? I think many people will want to think that, but it's actually half full on day 29, giving you the idea that once you get to day 29, the next day it has literally doubled. So from day 29 to day 30 isn't just an additional 2 leaves, it is suddenly doubled. You know, the analogy goes with our health system that if this exponential growth was not halted in many of the countries where we live and work, then that pond would be overrun with leaves and, you know, the hospital beds. There won't be enough hospital beds. Another ism or another area of life, which is kind of completely separate from health science, but a really complex area, is behavioral science and a new area called infodemiology. So WHO ran an infodemiology conference, and they're now calling for papers on infodemiology, so the study of misinformation. So when COVID-19 was declared an infodemic, we knew that it was both about the abundance of information, just a lot of information, even if all that information was accurate, but it's also about the misinformation and disinformation that came along with that. And why I mention this is because even if we get all that swift moving science right, and if we know how to deal with numbers and, you know, really kind of translate numbers to our audiences so that they get it, the kind of vexing issue is, what do you do with the fact that, you know, it seems to be that by supplying more and more and more accurate information, misinformation nevertheless keeps sticking. What is it about people that make them want to believe certain things, and other things that are credible just don't stick? So it's an area of science. In Internews, we do a lot of rumor tracking and information or misinformation management. And how we always put it is to say that fact checking is incredibly important. There's a wonderful initiative at Daily Maverick with William Bird and his colleague. Fact checking organizations have sprung up all over the world. But we say equally important is a reality check. The reality check is, even though people have heard the facts so many times, even though Tony Fauci or Stim Karim and people who kind of are the experts, who we feel kind of in a rational way, we feel those are the ones who should be trusted and believed on the numbers, there is something else that makes misinformation stick. Sometimes it's anchored in information people heard a long time ago from a really trusted source, like their aunt or their grandfather, or someone in the village, or the priest or an imam, you know, depending on where we report. We say it's as important to have to sort of do this reality check of what it is that people believe and why they don't actually necessarily sort of cling on to what is factual and evidence-based. So journalists have that double role. They need to know the facts, they need to know the science, it needs to be absolutely internalized, and then they need to understand that that isn't necessarily believed. And we adjust our storytelling to, you know, accordingly. Another area, which is an area almost from the field of philosophy from the field of planning and from the field of policy making is what's called a wicked problem. So COVID-19 has been called a wicked problem because the problem is this virus, this epidemic, this kind of exponential growth, the contagion, and the unknown aspects about it. So problems, the next word that comes to mind is solution. So what's the solution? So a wicked problem is one where the solution isn't evident and where there is such a complex interplay between evolving factors and the solution that you can at best call that solution mitigation. You can't call it a solution. So again, Trump has sort of, somewhat popularized among his constituents this idea of how can it be that the cure is worse than the problem? That's a typical example of not understanding the nuance of a wicked problem. It is a mitigation, it is not a solution. So one of the examples that we see lots of surveys. It's very popular in media to do a survey. So what's worse, the virus itself and the deaths, or the effects of the lockdown? When you embrace the idea of what a wicked problem is, you realize that it was never either or. The best communicators in science, if you listen back, have carefully said that it doesn't mean that lockdown is a solution. It doesn't mean that there won't be economic problems. And it doesn't mean that, as we see in so many parts of the world now, that there has been a kind of a much poorer uptake of other health interventions. People haven't gone for cancer screening, they haven't perhaps collected their ARVs, they haven't gone for TB testing, all of those things we hear about. Actually, the carefully communicated science was that all those things will come about, and it's not great. So the solution or the mitigation is often as bad as the thing itself. Or you could say that if you didn't put in place that solution, the thing, the original problem, would be only worse than it currently is. And where you see media having problems with this is, I think just the other day, Biz News, for instance, said, oh, prominent scientists, voices of reason now call for an end to all lockdown, all measures, give us our freedom, we don't have to wear masks and so on. The problem with that is that those won't be credible epidemiologists, virologists, immunologists. They may be credible voices, they may be actuarial scientists working in South Africa, with a grouping called Panda, for example, or they may be, for instance, Biz News had a story about a chemist who won the Nobel Prize for chemistry in 2013. He is now calling for the end of all restrictions. I mean, he's not an immunologist, a virologist, or an epidemiologist. And it also falls victim to what is also in philosophy, the fallacy of hindsight. I mean, we've all heard this. Look at this terrible lockdown. We've only, and as it turns out, the number of cases were so low. But if you understand exponential growth, you also understand that if it hadn't been for that stoppage early on in the growth, exponentially, those leaves would have overtaken the lake much sooner. And then comes another area.
Sorry, I'm going to interrupt you. You've got about 1 minute left.
Okay. So coming to an area which feels comfortable to most journalists, I would say most journalists attending the conference. Journalists are political beings. We like following politics. We can embrace that story really easily. Where it becomes problematic is when the spine of science is not understood. I want to bring in this picture from Germany, and maybe that, because I've got little time, just say, it becomes incredibly difficult when we live in countries where there is already distrust of government and of the state, and where there has been state overreach. And then those areas of investigation that Ferial spoke about are incredibly important, but also a little bit dangerous if they don't have the understanding of spine behind them. This protest in Germany, and I mean, I've got stories from our continent as well, but I think it's sometimes nice to jump away from one's known context and to say, in Germany, where there isn't a great deal of mistrust of government, there are now protests against lockdown. This is actually a poster in English because she wanted to send an international message. The Chancellor is a scientist. She's a research scientist. The lockdowns were entirely scientifically based. But the populace is now, and journalists themselves are now questioning the lockdown. And that's an area where, despite good trust in government, science is no longer backing up the reporting. Even more difficult for us who live in countries where governments have overreached, where there has been state police and defense force overreach and brutality against the public. So it's incredibly tough, but there is a salvation story. There's a redemption story in all of this toughness, is that there's the science we need to know. There are these new isms and ologies and areas that also influence our story. But there have been great moments of learning. Journalists have learned to kind of realize there is the next calamity, the next pathogen, climate change, etc., that we need to prepare for. And some of this intermixing of different areas of life and difficult areas of life have prepared us for whatever the next pathogen may give us as a very difficult gift to deal with. Thanks.
Thank you very much, Eda. Thank you very much. And thank you for explaining so much of the science to us. That is really, really useful. I'm going to move on to questions because quite a few have come in. There is a question that I'd like to pose to Asha and to Ferial, and that is, it's two questions in one. The one is, how stressful has it been for you to report on COVID? And secondly, how would you structure a newsroom for people to report effectively on an epidemic like COVID with the lessons that you've learned? Let's start off with you, Ferial, and then we go to Asha.
Okay. So I guess for all of us, it's been unprecedented times. There's a responsibility to be always on, but that has, I think that has come at the expense of many journalists' mental health, and also for those who were in the field. I haven't done a lot of field reporting, but for those who were, I think the requirements of, do we have the proper PPE? Do we have the correct insurances in place, which we know across our continent is not the case, because so many journalists are working as freelancers. So yes, it has been, I think, a difficult one. But I must say, in South Africa, I've really seen journalists rise to the challenge. And here we see this change from a commercial model to a mixed model that's often philanthropically funded and very well trained and skilled, has meant that I think the journalism community and its health reporting centers like Becky Sisa, like Spotlight, like Maverick Citizen have really served their publics well, and perhaps shown us that this is the direction in which good health reporting is going to go, because it's not, it has to be, and I think this is key to the structuring question, which you'll know well, it has to be slow journalism, and it has to be empathetic journalism, which is not about the gotcha model of saying you're wrong, this lockdown is wrong, being part of the tobacco or the liquor lobby. It does require dispassionate independence and assessment of all the information before you, and that requires high skill, much slower practice, and getting away from that commercial model of the shouting headline and the big and the kind of breaking news tag to win clicks, because this is not about that. This is about informing your public so that literally they keep themselves safe. And I was very interested to learn that 74% of South Africans, I hope I'm right, Ida, were actually wearing masks. So I think it's much lower now because we're at level 1. But I do think that it was both a top and a bottom. You saw it was a copying of good political practice, but also extremely good information coming to the system from various places, which I found has been instructive for as we do health in the future.
Thanks very much, Ferial. Asha, would you like to also have input?
I think covering COVID was as stressful as it was for everyone else around the world. Even as an investigative journalist, I think it was a learning point for all of us that, you know, we had to become students again, and certainly I did. And so I think when I accepted that fact, it became a lot better. In relation to the second question, how would you structure a newsroom now? That's an opportunity I've gotten with Debunk Media. I think, you know, working in mainstream TV in Kenya, I've noticed that there's little to no investment in data scientists, in researchers, in properly trained health journalists, science journalists, and I felt that this should be a priority in every newsroom today. I mean, certainly, you know, we're journalists, and sometimes some of the things that we know go up until a certain point. We need people to, as Firial mentioned, to take the slow journalism route, the niche storytelling. I think that, the fact that WHO had already warned about, a coming pandemic, like the coronavirus, and I don't remember any Kenyan journalists reporting on this. Because we are always thinking about the conveyor belt journalism. That is, at least in the mainstream newsrooms, conveyor belt journalism. What are we on today? And it's just, hand to mouth. I think this has taught us that in our newsrooms, we need people to sort of like look at the more proactive storytelling. So instead of reacting to something that's already happened, can we predict for our audiences, where the world is heading? Can we paint a picture of, the big issues that are coming up, and conclusively use data and science in a really effective way to tell our audiences, how these things will affect their lives? So that's what I think needs to be done. A lot of data scientists, researchers, more, science journalists, and niche reporting in our newsrooms.
Thank you very much, Asha. And there is a comment from Adele Baleta, who is a health communicator and a health journalist in South Africa, that really speaks to what the two of you have said now. I would like to read it. She says, it's rather dismal to hear that until recently, journalists think, even after Ebola and HIV, that health journalism is a soft option or the vegetables on the rack. This shows the dearth of science journalism in African newsrooms. And I would like to argue that's Adele, that we need more health journalism and that we need to invest in it. Sorry, my screen has just disappeared here, which is why I stopped reading. Let me just get that again. And that it is something that lots of surveys have shown that we need to invest in. Thank you very much for that comment, Adele. There is a question for you, Taryn. Do you think that COVID has brought more collaboration between the media, journalists, and epidemiologists? And do you think that would stay? And how can we use that to our advantage to get accurate and good information out there?
Thanks, Mia, and thanks for that question. I think, yes, COVID definitely has, with the increased need for information, there has been more links between epidemiologists and the researchers and journalists, because I think the typical reaction of a researcher is to run the other way when the journalists come. And I think that it's about not understanding each other's worlds. And it's about not having that engagement. And I think it's really positive to see that engagement has now been happening. The researchers and journalists are starting to work together. And I think it will be really great if we can unpack and see what more can be done to foster that engagement, to maintain and build that relationship. Because I think it's about I want to call it's about building a buddying system. It's about having a critical friend that one can turn to. And it's not about saying I'm better than you or the other way around, but it's about understanding and respecting one another and working together, because we're all in it for the same greater good. We all want to get the best evidence out there to the public. And in terms of health, we want to improve health outcomes. And value for money.
Thank you very much, Taryn. Ida, there's a question for you about what type of training do you think would be useful during COVID? I know I, as a journalist, have been on many trainings, and some of them I've not found that useful, even when, some of them are presented by people who don't necessarily understand the media. Do you think, how should we structure courses? Who should present them, first of all? And in which structure should they be presented? Should they be formal courses? Should they be mentoring? What works best?
Yeah, well, I mean, obviously, distance learning that we're all doing through Zoom now, like right now, has opened up like lots of avenues for more training, more discussion, more learning. But there is a danger in always just really inviting experts to speak, deliver their presentations, and then the time runs out, as could also be happening now. So kind of, it's a bit of a self-referential statement, but just to say that I think what is important is to understand one's audience. I think an expert be it an epidemiologist, a health journalist, or somebody who kind of has specialized in the field, will always assume that people know either more or less about their field, depending on their personality, I guess. You know, if somebody's arrogant, they will think that, you know, they know a lot more, and they may talk down to people. Or they may be steeped in a subject and not realize what fundamental questions are not being addressed. So I think the type of training where one has listened and deeply listened to what the needs are, and then kind of really tailored groups of people together with similar questions, would be more meaningful. There'd be more depth, and would be less a matter of taking everyone through the basics and just hoping that it has stuck.
Thank you, Ida. There is a question from Adamu Abu Bakar for Asha and for Ferial. And he wants to know, what are the lessons, what are the skills that you've used from your investigative reporting? For instance, Asha, in your case, on corruption scandals in Somalia, and Ferial, and in your case, you know, being an investigative journalist and a political journalist. We have spoken about the lack of skills, you know, that non-health journalists don't have health journalism skills, but there's a lot that health journalists can also learn from non-health journalists. How have you used your skills in your previous lives as journalists to report on COVID? Asha, we can start with you.
I think one of the skills that came in handy for me is on reporting around corruption scandals, and the ability to look at, you know, big amounts of documents and, you know, scroll through them and see what's happening and make sense of that. We're pretty good at doing that as investigative journalists. And, you know, corruption was also a big story in the, you know, the coronavirus pandemic. So that came really handy. Another thing is also, you know, having sources. So investigative reporters know that it's all about sources. It's all about, you know, trying to unearth what especially authoritarian regimes do not want people to know. And that investigative instinct kicked in, you know, for me. I think that's been like a really big lesson. And I also remember like some of the health journalists sitting down with me and saying, you know, how do we take this from being like a health story to a bigger investigative piece? We know that many regimes try to hide the numbers, try to hide the data. So with some of the tools, the open source investigation and investigative tools that we use for our reporting, they really came in handy when it came to, you know, connecting the dots on the coronavirus pandemic, especially when there was no data, or when we could sense that, you know, there was a hidden agenda with how some of the coronavirus numbers were being reported.
Thanks, Asha. Ferial?
So Mia, for me, it's been a different lesson, is to sometimes, not always, but to suspend skepticism and approach things with a greater sense of curiosity and empathy. Because I think the thing I've learned about COVID is that nobody had the answers, absolutely nobody. And to learn to be skeptical of those people who thought that they had all the answers, and to perhaps be a little bit more empathetic with the people who are at the front lines of managing this pandemic, be they the Ministerial Advisory Council, or be they the government in other cases, or the frontline doctors, and to just be, I guess, to walk in their moccasins. So that was a big lesson for me, to ditch a big part of my instinctive character. On the other hand, like Asha says, it was also vital to be able to follow that money and to recognize that the state capture, that's what we call the systems of corruption that we've seen the past 10 years here, that what we were seeing with the PPE, billions of rands which were misspent or corrupted, was we knew how to deal with big amounts of money with data. We knew how to follow that money, and that was, of course, very, very helpful as well. I saw a colleague had a question about how do you deal with government information, and this is where I thought that Professor Madhukar Pai was very useful on our course. He said you deal with it with checking in with the other side always. So in South Africa, for example, government kept foreshadowing the recovery rate a lot. And he said, no, you always have to view that data against a host of other factors to give a true picture. So again, to report in a multifaceted way has been very useful.
Thank you very much, Ferial. We have 1 minute left, and I would like to give Taryn just a final opportunity to also comment on that question about how do you know if the government speaks the truth, if the science or that is out there is right. What tips would you have for journalists? And I know you only have 2 minutes, so maybe 1 or 2 tips, and then we're going to end.
So just to start with, I think to always think critically, to always ask, where is this data coming from? What is the source of the data? Trying to get that source data and critically engage with the data, pull it apart, try to make sense of it. And if as a journalist you struggle to make sense of it, engage a researcher, a critical friend, which I've mentioned a bit earlier, and try to understand what's happening. Within evidence-informed decision-making, one wants to try to use best research evidence to inform the decisions that you are making. So you need to combine your research evidence with information from government, with information from policy, with information from the public, and you want to bring all of that together to make an informed decision. But the basis of it is to be critical and to be critical thinkers.
Thank you very much, Darren. That's a great note to end this webinar on Be Critical Thinkers. And to be able to be critical thinkers with science, it helps to understand how studies work. And we need people like you, Taryn, for that, to teach us in the media. Ferial, Asha, Taryn, and Ida, thank you very much for sharing your insights and expertise. We appreciate it very much. And it was really a helpful and a very interesting discussion. The next session that's going to be up for this conference is going to be at 3:30. It's going to look at investigating wildlife trafficking, and it's going to be facilitated by Fiona McLeod from the media startup Oxpeckers. If you'd like to join, from me, Mia Malan at Bekesisa, have a good afternoon and enjoy the rest of the conference.